I'm just gonna ask you whether you could introduce yourself for our audience.
Okay, so I'm Marie-Aline Bloch. I'm a professor at EHESP School of Public Health. Formerly, I was the Dean of Research of EHESP, and also formerly I was the Scientific Vice President of CNSA, which is a funding organization at the national level in France for elderly and disabled people.
So could you just explain to like a lay person what it is that you're doing in your everyday research life?
Okay, so as a health research scientist, we are doing in some of our research, we look at the place of caregivers and their representatives in the policy making and also in the evaluation of these policies. And for example, we have been able to compare what is happening in the field of disability to the field of aged people. And we could see that in the field of disability, associations have a strong impact, whether in the field of aged people, it's not the case today in France.
So how would you explain actually long-term care? What's long-term care in France? Because obviously long-term care can mean different things, to different people and in different countries. So what services long-term care covers in France and for what kind of people?
Yeah, in fact, in France, we don't use the term of long-term care.
Okay.
We have a distinction in 3 areas of our health and social care system. The first one is the sanitary, so the cure area with hospitals, ambulatory and primary care. The second one is the one we call medico-social, and home-based and residential care area with nursing homes and home care services. And finally, we have the third one, which is the social work area.
Okay.
And today, the 2 first areas are under the responsibility of our regional health agencies, ILPN, and the social work field is under the responsibility of our local authorities. But the local authorities are funding also the medico-social area. So you see, it's complex.
Yeah. So what would you say are the main, let's say, 3 priorities when it comes to long-term care? Although I know you said that, you don't use the term long-term care in France.
Yeah, in fact, if you look at the field of aged people, just now we have a new law for the adaptation of the society for aging, which is under discussion at our parliament. So there are 3 main objectives in this law. The first one is with anticipation and prevention, so to have a better access to technical aids, more collective action with regards to the isolation of aged people. The second one is on the adaptation of the society, on the housing, transportation, also on the rights of people and their protection. And the third one is to improve the care of people. And this is based on increasing benefits for dependent people to stay at home.
Okay.
Also reorganization of home care, and also revising the funding system for nursing homes. So you see there are a number of issues.
Yeah. So
maybe I can add, we have also the governance, which will be revised in this law, and with clarification between the IRS, our regional health agencies, and the local authorities being more, I would say, involved in the coordination of care.
So in terms of change of priorities, have these priorities changed a lot in the last 5 years? So for example, the trend towards prevention or home care, has that been ongoing, or is it new?
No, this is new. In fact, prevention was not so much put at the top before.
Yeah.
So now there is an awareness that we need to develop prevention. So this is more a start, but this means that there is a need for a culture change. Also, housing was not so much put at the top of the agenda. And also, finally, I would say, because of the financial constraints, like in a lot of countries, there is more emphasis on reorganizations, coordination, new processes, than on the creation of new services.
Okay. If you had an opportunity to introduce one long-term care policy in France, what would that be?
This is a difficult question, in fact. If I would have to choose, in fact, I think it would be important to move to a real unique long-term care policy for all people in chronic conditions. Today, we have a number of parallel policies for elderly, disabled, for stroke, Alzheimer, for cancer, which are implemented in parallel. So, which means redundancy, which means overlap, bureaucracy. And I think we should have more policies based on populations, not so much on the disease or disabilities.
In terms of research, what do you think is like one outstanding piece of research that would need to be carried out in terms of long-term care in France?
Yeah, definitely. I think the ways evaluations are performed for evaluating impact of new organizations is very important. And this should be using new ways of evaluation, like Poisson and Thiele realist evaluation process with qualitative and quantitative evaluation, taking into account also the context where new organizations are implemented. For me, this is key. So we are just starting a research project on that for the MAIA, which are the integrated and coordination of care for elderly people, and another national program also that will be using this kind of process of research.
Okay. So my last questions, I'm going to ask you a number of very quick questions, and I'm looking for answers from 1 to 5, when 1 is low and 5 is high.
Yeah.
So the first one, what policy priority is allocated to long-term care in France?
So for me, it's 3, because the new law has been postponed for years. So I would say we still are not very good. My point. So.
Okay. Yeah, that's very low indeed.
Maybe I'm too low, but compared to others, maybe French people are more critical than others.
What about the awareness of the public about what long-term care system offers to them? Do you think the public are aware of what the long-term care system offers?
I think this is changing. I think in the past I would have put 3, and now I would go more to a 6, because there is a lot of effort for information. There is a new website, national website that was launched 2 weeks ago, and I think this is changing.
Okay. How well do you think the long-term care system overall supports people with obviously long-term care conditions in France?
I would put a 4, because we have issues for the rest to pay for people in nursing homes, which is very heavy. It's very important, and there are also issues for the home care services, where some have bankrupt. So this is critical. So there is we are waiting also new regulations to help these services to develop, in fact.
Okay, what about carers? How well do you think the system supports carers in France?
Yeah, I think this is changing as well. I would say it used to be 3. I would put it more to a 5 or 6 now, because there has been a lot of efforts to create services in support of carers, and in the new law also, I forgot to say, there will be something for the support of carers with the definition, with the taking into account the training of caregivers, for example.
Okay. And the last one, how well do you think are integrated the social care and healthcare in terms of provisions of long-term care?
I would say this is changing also. I would say maybe 3 to 5 now with the Maya. So it's the complexity makes it slow. It's a slow process, but it's moving in the right direction.
Okay. Well, that was my last question. So thank you very much for speaking to me today.
Thank you.